So how will you introduce yourself over the phone? You will enter into the station, you will see there will be a PTCL and or extension, and you have to pick that phone up, and scenario will be written outside and as well as inside, and where details of the patient will be written. It will be written patient's name, patient's age, and patient's address. So now you will start with the you have to speak first during the telephonic conversation. First of all, don't wait for the next person that person is going to say hello or something like that. You will pick the phone up and you will say hello, and the next person will say hello, and you will say, this is Dr. Ghazal Matloob, and I'm calling you from the hospital, from the NDU hospital, for example, let's say. And I can see from my notes that you wanted to talk to me. Is it a good time to talk to you? And patient will say that, yeah, okay, it's a good time and you can talk to me. So even before that, you will say that, am I speaking to, and what is the name of the patient, rather than saying hello, this is Dr. Ghazal Matloob, and can you please confirm your name and age for me. It's robotic, and it's like that patient is not sitting in front of you. So you will say that this is Dr. Ghazal Matloob calling from the Andrew Hospital, and I can see from my notes that you wanted to talk to me about something. Am I talking to Mrs. Ellison Parker? And she will say, yes, I am Ellison Parker. And you will say, and okay, Mrs. Ellison, can you confirm your age for me? She will tell you, and then you will say, okay, and is it is it a good time, or is it the right time to talk to you? If you're busy or anything, just let me know. She will say, no, doctor, it's completely all right, and I'm free, and you can talk to me. And then you will say, okay, before we move forward, Mrs. Ellison Parker, can you please confirm, are you living at? Now there comes an ambiguity. Many candidates ask for the address from the patient. Like they will say, can you confirm your home address for me? And that person will say this and all. But if you ask from the NHS doctors who are actually working in NHS setup, I have asked them, they will tell you that actually in real life, we do not do that on telephonic conversations. We actually confirm the address by saying the address. So actually, if you want to impress the examiner, so that examiner know that you know the NHS system, you will say that, can you, okay, are you living at, and whatever the address is written there, you will say that address, and she will say, yes, doctor, I'm living at this address. So fine, now you will say, okay, can you tell me that why did you want to talk, did you want to talk to me, or over the phone? Is it something really urgent, or is it something really that is bothering you? So telephonic conversation many a times is about a son or a daughter, and mother of that son and daughter is talking to you. Sometimes it's a breaking bad news station where you have to break the bad news over the telephone to the son or daughter. And third scenario is where the patient, it's him or herself, will be talking to you. So identify that what kind of station it is. So if the station is where the next person you are talking to is not the patient, you will start the conversation that, am I talking to the name of the person you are really talking to? But you won't ask the age of that person. Now you will say, I can see from my notes that that you are the mother of Joshua. Is that right? She will say, yes. And can you confirm the age of your son for me? And she will say, yes. And then you will say, and can you confirm your address? Are you living, do you and your son are living on this address? You will say this address, but you will just change the sentences accordingly. If it's not the primary person you are talking to, if that person is not the patient. And if it's a breaking bad news, please, when you make a call, at least sound sad or a bit low, rather than picking up the phone and answering it in an exciting manner. from the very start of your conversation, even when you're asking that person about the details of the name and age, you should always say that, in very low voice, in low tone, or in a gloomy manner, so it will give a kind of a trigger warning to the attendant of that patient. After that, don't break the bad news just straight away over the phone. You have to tackle breaking bad news over the telephonic consultation in a very decent manner, in a very intelligent manner. And you will say, after asking that, is it a good time to talk to you? You will say, are you in town by any chance, Mr. Joshua? And he will say, yes, I am in the town. And you will say, and I was thinking if you could come to the hospital and we can have a conversation, rather than saying that, okay, your father is dying and all. It's very bad. So that person will say, yes, doctor, I will try to come, definitely, but now you are saying that it is making me nervous. um, can we talk over the phone? It's okay, you can tell me anything on the phone. You will say, okay, while we have this conversation, if you want someone along your side, on your side, I can put the phone on hold and just let me know when that person is with you, and then we can discuss it. So like that, you're still offering the patient one support system before you break the bad news. Like, you're following the protocol for the breaking bad news. Even you can follow what point I want to make is that even you can follow protocol over the telephone, and it is really impressive if you do that, and you will get full marks. uh, I think I'm clear about breaking bad news. And if it's a mother of any toddler or something, and if it's a primary patient, you will just go ahead with the normal conversation that you are doing with the patient. And please try to make your voice clear. If you don't sound clear on the phone, it could cut your marks. It's not only about the examiner. Your patient should understand everything that you are saying there. Now I will share one small teeny tiny experience from my exam. It's that I had two stations. One was a telephonic conversation and one was a video consultation. Now, when I came out of the exam from the center, I was talking to my colleagues and I told them, yes, I actually nailed, both telephonic consultations. And they told me that, what are you talking about? There was only one telephonic consultation. There was no other telephonic consultation. That was video consultation. And see, what blunder I made is that there was a big TV screen on the wall, but when I entered into the cubicle, I just saw straight away extensions, which I was supposed to pick it up, but I had to watch the screen where patient was there on video call, and he or she can see me, and I can see my patient there. But I was looking to the ground for whole 8 minutes and talking. It was like I was drowned into that phone call and only seeing my toes, feet, and that floor. But station was really good. Like, I did everything that station required. And I have only one station in my plab too. I have passed every other station. So I just considered that station fail. I knew that, I'm going to fail because what a big blunder could it be that, like, I haven't seen the screen. And, patient must have think, or examiner must be thinking that how dumb she is. She don't know that it's a video consultation. It was really depressing for me, but somehow I knew that no matter what happens, I will still pass my exam because every other station was really good for me. But when my results came, I got really good marks. I got 10 out of 12 in that station. And I was shocked. So what is the moral lesson of this story that I'm trying to tell you? Even though I wasn't able to appreciate that it was a video consultation, which I should have, but examiner considered my tone, my empathy, my management for the patient, my voice, and my opening, my introduction to that patient, and my data gathering from that patient. I did everything right. It's just that I didn't saw it was not making any difference to the examiner because I was not seeing the screen, because it didn't compromise my patient safety, interpersonal skills, empathy, support system, management, whatever you name it. So even if you make this kind of mistake in your exam and you find it not after the exam, but during you are doing the station, do not panic. You will still pass the exam and you can cover that situation. Oh, I'm really sorry. I didn't see you. I didn't saw you. I didn't observe that there is video here. My apologies, but just skip it. And now, like, we are going to start a conversation where we stop, and then you will just rotate your chair and start watching towards the screen. But don't make it a big deal. If your everything is on point, which is not compromising your patient's quality, you're still good to go. Okay. Like, if everyone ever understood or not, please just let me know from my experience. Hey guys, can you hear me? Yeah, okay. Okay, great. So what was the other thing that I said I will cover today? One was the telephonic consultation, one was anorexia nervosa. Third thing? Yes, I think it was discussing the lab results with everyone, right? Everyone, not with everyone, with patients. So if it's a station doctors where you are given a task, you are reading scenario and they will say that Mrs. XYZ came to you last week and she had her full blood count and it shows that patient HB is 9. Now, enter into the cubicle and talk to the patient and discuss the results with the patient. Now, what this station demands from you, you need to understand that. This station demands from you to disclose the lab results. This station does not demand a complete data gathering, taking history and doing examination. This station only demands one teeny tiny simple thing, and that is disclose the blood results, make her understand that what's wrong with her HP. Now, candidates, I can safely say 95% candidates will make this station history-based station. Okay, why did you present it? Can you tell me more about it? Do you feel dizzy? Do you have any family history of heart diseases? Like, are you married? And how are your periods? And can you tell me that you had pap smear in every 3 years? Do you eat healthy? This is all bogus. 6 minutes, and then in the last 2 minutes you disclose the results, and then you fail the station. And when the result will come, that candidate will say, oh my god, I did so much good in this station. Sorry, someone asking a question? Okay, so as I was saying, like, they will give only 2 minutes to the real task that was being demanded there, and 6 minutes to the thing that was not even demanded there. In lab discussing results, you should always understand that this is a station where I have to give 6 minutes to the lab results and 2 minutes only to the history part. You can actually write it and make a note, like, I will always, whenever there is a lab result station in your exam, enter into cubicle by reminding yourself, I won't take history more than 2 minutes. I won't take history more than 2 minutes. I won't take history more than 2 minutes. I hope this is clear to everyone. Okay. So when you enter into the station, I posted one golden tip that I used to post in my WhatsApp group. I posted one day that don't make disclosure of the lab results conditional thing. Many candidates will say, like, if the patient is waiting for you in the cubicle, the patient will anxiously say, well, doctor, can you tell me what's wrong with my reports? You make it conditional. You make it sound like, okay, well, yes, I will discuss your results with me, but this but is conditional. can you please tell me few things which I'm going to ask you first? Can we have a little chat together first and then I will disclose the results? Does it make sense? No. Like, I will give you an example. You, you have opened your account into a bank. Now you want to go there and you want to know your account number and you want to collect your ATM card. Okay, I'm just giving you an example. Now you have entered the station, entered into the bank, and you have met that manager, and you will say, okay, has my account opened? Can you give me my account number and can you give me my ATM? And that manager will say, yes, definitely, I will give you your account number and your ATM card. But let me ask you a few questions. Where do you live? And are you interested in our schemes? We are giving this loan, we are giving that discount. Now tell me, don't you feel irrelevant? Do you feel that manager is silly? I'm here for something else and he's telling me all those stories. But once you have given me ATM card and my account number, and when I got the thing that what I was here for, and then manager can say, okay, miss, are you interested if I tell you about two discounts that our bank is giving? Now even I will be in that mood to listen to that manager because my thing has been done. So don't make it conditional. When you do that, it sounds irrelevant. I hope that I made a really good example for all of you to understand it. Now, if the patient is not asking about the blood results directly, you can always do the 2 minutes history first and you can tell the results later. But if the patient is anxious and asking directly from you that don't tell me the results, even don't delay, don't like don't convince her that I will ask question. So you can nicely say yes, and don't make a statement while entering into the cubicle, what brought you here today or how may I help you today. It's silly because patient will because it's written in your notes and patient know that someone is going to talk to me about my blood results and you have blood results in your hand. So is it making sense to you that you ask why are you here? uh, you have to give a different introduction. You have to actually say, well, uh, Mrs. Allison, I can see from my notes that you're here for the blood results that we took from last week, that we took from you last week. Is that right? She will say, yeah, doctor. Then you will say, okay, how was your week and how's your health? She will say, it's fine. Okay. So Miss Ellison, I have your blood results with me. Should I disclose them first, or can I have a conversation with you about like so that I can confirm, I can correlate my lab results with your history. So if patient say, I want to know about the lab results, or even the patient is not waiting for this question and patient directly says, please tell me the results, just go for the lab results. You will say nicely, now in the lab results, there are two parts. There will be few tests which will be normal. There will be few tests which will be abnormal. You will always talk positive initially. You will start with the things which are normal in that patient. Well, we did your full blood count, and in your full blood count, fortunately, your white blood cells are good, your platelets are good, and your volume it's good. But there's one thing that I want to tell you. I'm afraid that your blood is thin. In the UK, blood is not thin, blood is weak. In the UK, for the low HB, they use the term weak blood. So you will use that term for the patient. So your HB is on the lower side. That means that your blood is weak. And if a normal person should have around 12 bottles of hemoglobin, in your case, it's 9. So like you are giving a reference number. A good doctor will always tell the patients the reference number, what you were requiring in that patient and what's deficient in that patient. And many people don't do that. Okay. So like that. After that, you will say, okay, I need to find out that why your blood is weak. Can you tell me, do you eat healthy? Like, do you eat everything? By any chance, are you vegan? And by any chance, you have heavy periods, irregular periods. Now whatever the, station was, now you can ask the relevant questions after that. Is it clear to everyone how to do lab discussion result stations? Like, am I making sense to everyone? Please let me know. Okay. Okay, great. So I'm pretty much done with everything that I wanted to tell today. Now I would like to do one station with one candidate. Is there anyone who want to do a station with me today? Anyone who want to do a station today? No one?